Face mask wearing can block or filter airborne virus-carrying particles from spreading from human to human. It has played an important role in protecting everyone by reducing the incidences of infection through airborne transmission. Thus, it is a crucial measure to prevent the COVID-19 virus from spreading via airborne aerosols. The outer layer mainly removes the large-sized droplet and aerosol particles. The second layer is an electrostatically treated filter which could absorb bacterial or viral particles and their aerosols. The support an inner layer provides is skin-friendly with another physical barrier for various particles. When you wear a mask, you protect others as well as yourself. Masks work best when everyone wears one. A mask is not a substitute for social distancing. Masks should still be worn in addition to staying at least 6 feet apart, especially when indoors around people who don't live in your household. Here are the basics of how to wear a mask. Clean your hands before you put your mask on, as well as before and after you take it off, and after you touch it at any time. Touch only the bands or ties when putting on and taking off your mask. Make sure it covers both your nose, mouth, and chin. When you take off a mask, store it in a clean plastic bag. Wash it every day if it is a fabric mask, or dispose of a medical mask in a trash bin. Don't use masks with valve. May 23, 2021, the Ministry of Health of Malaysia, MOH, shared effective ways of wearing double face masks, citing the best practices of America's Center for Disease Control, CDC. Double masking would substantially reduce exposure to COVID-19. The CDC recommended double masking by using a surgical mask on the inside and a cloth mask on the outside. The cloth mask should push the edges of the disposal mask against your face.
If you can't do double masking, to enhance face mask wearing, we cannot do ear loops of a 3-ply face mask where they join the edge of the mask. I will demonstrate to you. First, fold the mask from edge to edge. Then, make a knot in each ear loop. Push the knot as close to the mask as possible. Next, fold and tuck extra material under the edges of the mask. Hold the mask up to your face and gently push the nose wire against your nose. Place the ear loops around your ears as you normally would. Be sure to remove any gaps around your nose and cheeks for the best protection. This is what we call the knot and tuck.
Now, we are well informed on how to wear masks. However, there are some precautions that we must take note as well, such as don't touch your mask or your child's mask while it is being worn. Don't wear the mask under your chin with your nose or mouth exposed. Don't leave your nose or mouth uncovered. Don't remove the mask while around others in public. Don't share your mask with family members or friends. And don't combine 2 disposable masks. It is also advisable for us to wear a face shield in addition to a mask when we are in a public high-risk environment, such as hospital, clinic, and poorly ventilated areas. Face shields might provide eye protection as it reduces the potential for contamination through the eyes. This property is particularly interesting in the fight against COVID-19. That's all for this segment. Don't forget, wearing a mask in public helps protect those around you, but only if worn properly, covering both your nose and mouth.